So welcome to the great Big Indian Wellness Show. If you've missed any sessions, you can head on to iglobalnews.com. In today's session, we're going to be talking about alternate medicine versus modern medicines. And I have two very eminent speakers with me here today. One is Rajiv Kagvi, welcome to the show. And the other is Dr. Jaideep Joshi. Now, Rajiv is a health coach and he's at Online Wellness Academy. He's a pharmacist, health coach, and functional medicine educator. Using the concepts of functional medicine, he coaches people on how to reverse chronic health conditions without using pharmaceutical drugs and getting to the root cause of the disease. He believes its merit as great alternate to modern medicine. For example, he's helped over 50 people reverse metabolic syndrome, such as type 2 diabetes, raised cholesterol, and high blood pressure using this alternate approach to modern medicine. Dr. Jaideep Joshi, he's an Ayurvedic physician and a consultant at Joshi Ayurvedic Clinic. He's a highly qualified, qualified integrative Ayurveda physician and counselor, a leading evidence-based practitioner working in England for over 2 decades. He draws on person-centered and integrated approaches and offers the therapeutic balance of these two approaches that will be most helpful for his clients. So, Dr. Jaideep Joshi, I will start with you because you have a wealth of experience in alternate medicines. Namaste. So I really want to know what is the scope of treatment in alternate medicine, and have you seen a change in trend over the past decades?
Yeah, namaste everyone. It's a very good question actually. It's a very relevant question for this modern era. We call it alternative medicine. As an Ayurvedic physician, I would like to say Ayurvedic supplements or Ayurvedic medicine or Ayurvedic therapies. Everybody knows modern science, conventional medicines is research-based, but so many people are still struggling to understand that Ayurvedic medicines are research-based as well. Thus, Ayurvedic medicine we call is alternative medicine. But if you can find so many journals, too many Ayurvedic medicines and supplements are now research-based. So you can go on journals, WHO journals, or some private journals, or if you know some doctors or scientists, their own journals or research paper. Too many medicines are now research-based Ayurvedic medicine. And it's all plant-based medicine, or maybe some other metal-based medicine as well. But in European countries and other Western worlds, we are using generally caste-based medicine, means plant-based medicine, and it's effective. And in this pandemic, in my talk, I don't want to use too many words, too many time about pandemics or COVID, but in this last nearly 2 years, people are very much interested in this Ayurvedic supplements or medicine.
Yeah.
Because they got a fantastic results and they're so happy. But personally, let me say, I am not against of modern medicine or conventional medicine.
So interestingly, you mentioned pandemic, but we've also seen a very huge increase in the interest in mental well-being. And we also know that alternate medicines, they work not only on physical level, they work on emotional and a spiritual level as well. So is that why there is more interest in it?
Absolutely. Your question is important because of this panic atmosphere. Too many patients I have seen rather than cold cough and COVID positive patient, I have seen too many mental disturbance patients, too many patients, especially with the youngsters and middle age. They struggle a lot because of certain lifestyle changes, certain food habits changing, they're not habituated to sit down in a home. They don't know how to work online. They like to people company because we are human. We are social animals. We like to human touch or human company. And because of this reason, you are absolutely right. Psychological disturbance patient and psychosomatic patients.
Because it really works on the root level, isn't it? The alternate medicine. So my next question will be to you, Rajiv, and then I'll come back to you, Dr. Joshi. Rajiv, interestingly, you have worked as a pharmacist and worked very much with modern medicines, and now you have moved on to alternate medicines. So I really want to know why that shift has come. What made you bring that shift? Is it because the modern medicines, the Western medicines, really work on the symptomatic level, but the alternate medicine offer a approach where you can actually work on a very patient-centered level? So what was the reason?
Thank you, Ekta, for the introduction. So I've been a pharmacist for over a decade now, and in that time, I must have handed over 10,000 pills to probably 10,000 patients. And what I'm seeing is a system that is fundamentally broken in terms of one is treating the symptoms, but I'm giving us loads of band-aids, but not actually addressing the root causes of these issues. Now, how I awakened to realizing I'm part of that broken system, one which pushes a pill for every ill, one that keeps us going round in a hamster cage of stress, feeds us toxins through our food and environment, is when my dad came home and he said, son, I'm going to be on a lifetime of worth of medications for diabetes. So I was pretty shocked at this stage. My dad's always been healthy, he eats really well, he walks a lot. I'm thinking, how does this happen? So my whole system told me there was a different way. So I educated myself and dedicated myself to coaching my dad. And today I'm so grateful that he's not taken a single pill, he's diabetes free, and he's in the best health ever. So what did I do? I started to study functional medicine, which is an alternative type of medicine. It's a very patient-centered and science-based approach, which addresses the root causes of the issues and promotes optimal wellness. By addressing the root causes rather than the symptoms, it allows one to identify the complexity of diseases. One may find that one condition has many different causes. Likewise, one cause may have many different conditions. As a result, functional medicine treats the specific manifestations of disease in each individual. So, it's if you think, okay, one thing causes a lot, but it doesn't. So, it looks at the human body as an overall mechanism. And also, as I said, it provides optimal wellness. So how does it do that? It's very simple. There's a model called the maximize, minimize, optimize model. It's so simple, but people don't look at it. So when you're working with the individual, you want to maximize what's good for that individual. So the raw materials the body needs to function and heal. So that's basic things like oxygen, water, vitamins, minerals, antioxidant, good proteins, healthy fats. You want to minimize, take out what's harmful to that person. In this day and age, stress, trauma, allergens, toxins, infections. And we want to create an environment, prioritize something for healing. So sleep, people are deprived of sleep these days. Rest, they think if they rest, they can't rest. Stress reduction, exercise, and meaningful relationships. When you balance this optimal wellness, the body naturally seeks balance and wellness. So I started doing these things with a lot of my patients, just simple health habits. And, like in my practice as a functional medicine pharmacist, I reverse things like type 2 diabetes. You've got to remember, type 2 diabetes root cause is carbohydrate overload when you think about it. And its reversal is, simple: reduce the sugar input, eliminate the glucose storage, restore the insulin sensitivity, and increase the glucose use. High blood pressure, root cause, stress. Reversal, mind and body solution for stress reduction and optimal mental health. And finally, this one really makes people think it's arthritis. The root cause, inflammation and unhealthy gut microbiome. You're like, what? If you fix and heal the gut, you can reverse many of things like eczema and arthritis. And you can do this by eating whole, natural, dense food.
So if I understand it, you're working more on the emotional level and the spiritual level, along with the actual pill. And Dr. Jaideep Joshi, Ayurveda, the alternate medicine, Ayurveda, it works more on it also affects us on physical level as well, not just the emotional and spiritual level. So is there not, do you think there is enough awareness about the power it has, especially in younger generation? Are they more aware of its potency?
To be honest, not 100%, right? But because of this scenario, because of this situation of this world now, all youngsters are thinking like Mr. Raju. He himself a pharmacist. So that kind of personality is now thinking, what is this? He learned from his father and he's just observing his father. So this is the scenario nowadays. Too many youngsters are coming and they have a question. But if you don't give them proper answer, they start struggling. But
so do you think there's enough places where they can go and find the answers?
At the moment, I'm say they are rely only on internet. means YouTube videos or some discussions, some talk shows, or some, basically is internet, right? There is no in Western world, especially in United Kingdom, there is no center to learn certain deep side of Ayurveda. Okay, some experts are teaching the Ayurveda in a different way, but that's a different scenario. But if you like my son, he is 22, right? He wants to learn about Ayurveda and he wants to be qualified in Ayurvedic medicine or Bachelor of Ayurvedic Medicine and Surgery. There is no course here. So he has to go either India or some other Eastern countries to learn about this subject.
Because it's not really teaching him how to adapt it in model mode. But Rajiv has very, very interestingly done that. He has been able to collaborate that in a certain way. So you do see that as a problem here.
In a way,
not
yes.
enough research is being done.
Not research is there, but not keep in touch with the youngsters. If you not give them proper answer, they have no clue, because they are very black and white people. What I experienced in this 15 years of my practice in England, I'm practicing nearly 15 years as an Ayurvedic consultant. But too many youngsters are coming, and if you don't explain them scientifically, okay, what is Vat, Pitta and Kapha, and what is your constitution, and why this constitution is dominating you, and which kind of food and diet and lifestyle you have to change according to your problems. If you can't explain them scientifically, okay, Vat, Pitta and Kapha, we just bombarding them, don't eat them, don't do them, don't do, no. Why you should not do this?
So Rajiv, I'll ask the last question to you now. So very interestingly, you have collaborated to a very good extent this both alternate and modern medicine. Did you find the same struggle that there wasn't enough awareness and research about it? Are you struggling to tell people about this? And also my question to you would be a closing question. Is there a possibility of collaboration? Is NHS doing enough? Taking enough interest in it? Do you see a collaborative approach towards diseases, towards this modern medicine and an alternate medicine?
Yeah, so once again, more awareness is required. I know there's YouTube, as Jade mentioned, there's these things, but people it needs to become fun for them. Not anyone can watch YouTube videos, Google symptoms, but when you start Googling stuff, you're stressing out because, the things they show you in Google straight away is a big C word. Got a sore throat, ask your doctor, it may be cancer. Certain things like this scare young individuals. It certainly did with me as a pharmacist. Anything I'll Google, I'll start thinking, what is this? So, but that's why I created Online Wellness Academy. What it is basically, I create courses for people like generally young age, and people do a lot of online courses these days. So once they do the courses, and then they can get a bit of coaching, just to change up the way we're teaching the young generation these days, because they're not going to go to the doctors. They don't see their GPs because they're going to wait 3 to 4 weeks, so they're completely going to forget about it, and they're not going to wait 8 to 10 hours in A&E. So, but back to your question, complementary and alternate medicines, as identified by NHS, is very limited. They don't offer treatments. There's only a few, like the Alexander technique for Parkinson's, for example, which has been commissioned.
So you see that there is a scope, but it's not being done enough.
But the regulation is not there.
So I'll just quickly ask the same question to Dr. Jaideep, and then we'll have to end this. Yeah. So Dr. Jaideep, do you see a collaboration in both?
It's very difficult. NHS means very difficult. Conventional medicine scientists and doctors are still struggling to understand. They know everything. Very honestly speaking, I have in last 1.5 years, we have too many doctors. I personally contacted them and I talked them. They also believe in it, but so certain systems they have to establish, like acupuncture. Okay, that's fine, but we call it marma puncture point in Ayurveda. They call it acupressure physiotherapy. We call it marma pressure point. We call it effleurage massage therapies. So everything is same, but certain systems, maybe by politically, maybe by some other stuff, we have to establish this science in a very, very scientific way in this modern world. And believe me, yeah.
And so we can come to a conclusion that there is a lot of scope, there is a lot of research, a lot of material to go and read about it, but there is not enough awareness about how powerful these two are. So well done to you, Rajiv, for actually complementing these two. And Dr. Joshi, of course, your experience and expertise. I hope we find more people like you educating the younger generation about this. So thank you so much for being with us today. Thank you.
Thank you very much.
Thank you very much.
Thank you.